Thank you, Rebecca. I'm just delighted that hopefully that was recorded as a comment. I'm going to play that before my dissertation defense later on this summer. Right, time is tight, so I'm just going to move swiftly into this. Thank you very much for inviting me. One just quick addendum to the slides that I'm putting up. These are reconstituted slides that I've had to put together again this morning, which means that sadly they're missing many of the references to the figures that I'm utilising. And I just want to be upfront that my work here is presenting actually excellent work done by a number of institutions, many of whom are represented in this room, and I will make sure that before they're circulated that those acknowledgements are included. Right, so I'm going to start off just very briefly by thinking about what it is we think economists do and what the function of economic analysis is, notwithstanding that Larry Summers talked about this earlier. So we usually think there's some kind of a question that we want answering, and that with the aid of some clever algebra, we might get some sort of a prediction that we can then make a resource allocation decision on. Right? Nice and linear, fairly straightforward. Give me this dollar and cents effect of this so I can argue for an investment in it. It's a very positivist view of economics, and just not to labour the point, that's not really what economics does well. Economics is a frame for thinking about resource allocation decisions. And it's my personal opinion that actually the major role of economic analysis in public policy issues like infectious disease outbreaks is to structure a conversation. But at best, it can only ever be one input into a decision-making process. And I'm going to come back to that a couple of times in the talk. So this is the idiot's guide to what we do in economic analysis, targeted at myself more than anybody else. But I think there are two essential modes of economic analysis. One is what I call the Snowglobe approach, where you just build a version of the world that you think might be true, and then you simulate shocks to it. You shake the snow globe, and then you see where all of the snow lands. And you say, oh, well, our simulation suggests that actually if this outbreak happened in this locality, it would cause this damage. And if you're really diligent, you might shake the snow globe again, and again, and again. You might shake it 20 million times and end up with 20 million distributions of an estimated impact. But essentially what you've done there is you've built the perception of certainty on something that depends almost entirely on your model inputs, and we can discuss those in a second. The other mode of economic analysis, which is the one that I'm clearly a bigger fan of, is an empiricist approach. And it's one where you stop and measure the things after they've happened. And the broad thesis that I'm going to put to you today is that we're not doing enough of that when it comes to infectious disease outbreaks. And we need to move from a modeled world to a measured world. Okay, so this is my one sort of important and helpful slide. This is my one slide of sort of structure and theory. To think about how it is that an infectious disease outbreak like Ebola or Zika affects an economy, you can just build a very simple model of what's going on. So there's some reservoir of disease that finds its way into humans. Once it's in humans, that's an outbreak. And that outbreak causes some biological effects, the disease, and that disease causes illness. And that illness can result in death, disability, or some degree of recovery. And associated with each of those states is a change in consumption, that's the C, and the subscript S is short-term consumption, and in productivity, what you can usefully contribute to society. And again, you've got short and long-term effects there. But in addition to that biological event, there's a set of social events. There's an informational event, and there are behavioral events. And as was mentioned by Peter Sands earlier, actually, this is where we think the bulk of the economic damage is done. So individuals change their consumption patterns. They might use more healthcare. They might not go shopping. They might not travel to a disease-prone area. They might travel elsewhere. So you get sort of deferred or shifted consumption rather than lost consumption. And you get changes in productivity. Under organizations there, that typically would say firms, but actually often when we're dealing in a global health context, it's not just firms, it's not just companies that matter. Other non-governmental actors can influence the economic outcomes, and the outcomes you're looking at there are again, consumption, productivity as an export, and then I is there as an investment, so incoming investments to an area. And all of these things can shift in response to an infectious disease outbreak. And then finally, you've got the government response, and governments can spend money or they can impose regulations, cordon sanitaire, they can shut ports, and all these things then link to economic activity. So the top part there is what would classify as the transmission dynamics model. We've been doing a lot of work in public health for a number of years now. There's some excellent work that's done understanding how diseases emerge and spread, and we should continue to do more. We have the disease dynamic elements to it, which again is sort of the infectious disease epidemiology, the clinical responsiveness. And again, that's good, important work, and it needs to be done. The thing we're all here to discuss, though, is that bottom left corner, which is sort of has been historically, when it comes to emerging infectious disease outbreaks, sort of these acute flares, the forgotten dimension of health security. So right, you've got that model. It's as simple as just measure all of those things, and that's your net economic costs. I did have a version of this slide where I then drew all the linkages from those things that looped back, because it's a non-linear set of processes. And I'm sure it's not lost on you that this is complex, but we could do a much better job of just collecting that empirical information after these events than we're doing right now. Okay, so when you think about economic vulnerability, the way that we thought about it, this comes from a paper that Peter Sands, Victor Zhao, myself, and a colleague Phil Sanish published in The Lancet a couple of years back. There are a number of different aspects that might affect a country's economic susceptibility to damage. There's this intrinsic vulnerability, which is just the likelihood of an outbreak occurring in a territory and spreading through a population. There's then the sort of mitigation potential of a population. So what are your health system strengths? What's your sort of pandemic preparedness strength? These are the kinds of things that we're picking up and measuring through joint external evaluations. The piece that isn't done as rigorously or as consistently is the next part, which is actually looking at the industry sectoral vulnerability of different locations. And we've done some work beginning to look at sort of which industries are hit by outbreaks in which locations. And actually there's some predictability here which we could wring out. We could get much better estimates of what's happening with economic impact if we just did this post-event empirics. And those things come together into an overall assessment. So now I just want to spend the last few minutes doing what I was asked to do, which is compare Ebola and Zika. And I mean, the broad summary of what I'm going to tell you is that Ebola and Zika differ in their economic effects because of sort of differing phenomenologies of the pathogens and their disease spreads. So I'm going to suggest that Ebola is more like a rapid forest fire that's flared up, goes through its epidemic curve, and then settles down and becomes quiescent, and that Zika has now turned into a slow-burning endemic problem that will circulate. And the fascinating thing is that despite the fact they have these very different characteristics, they are still both capable of causing quite substantial economic impacts, as you'll see. So just reminding ourselves of Ebola and Zika's disease dynamics, lots of slides lots of figures on a slide, right? The kind thing to do would just be to point you in the direction of the thing to look at, which is to say that Zika has actually infected far more people than Ebola has. But the clinical syndrome associated with it, in the acute state at least, is a lot less severe. Most of the damage that's done from a health perspective is actually to do with these neurological complications that we'll talk about in a moment. But the other thing that you'd notice about the difference between Ebola and Zika is that there is something qualitatively different about the emotional characteristic of a hemorrhagic condition, the concept of bleeding from your orifices, versus something that makes you feel a little bit like the flu, and if you're not going to get pregnant and if you don't get Guillain-Barré, you kind of move on. And these things may well interact quite strongly with population behavioral responses, and it's an area that, again, I'm going to suggest that we need to do a little bit more work on. Okay, so we've got this quiescent now, but very dramatic outbreak, and we've got this sort of slow-burning arboviral infection. How does that play out into the economics? Well, these are estimates that come, these are nearer post hoc estimates. These are more recent estimates, 2017, 2016, from the UNDP and from colleagues at the World Bank. And what you'll see is that despite the fact that Zika only actually killed 15 people, infected 500,000, now grumbling on, it's got this quite significant sort of set of economic burdens. So 7 to 18 billion across the LATAM region, with long-term costs of 11 billion associated with the expected cases of microencephaly and Guillain-Barré syndrome, lifelong costs. We haven't actually looked at what the shock long-term costs of Ebola are. And my sense is that if we began to think about what these impacts might have been, population distributions, migration from periods, the effects on investment confidence, we might find quite big notches there. But again, I'm just going to complain that we don't do that. I'll conclude because I've got 10 seconds left. Look, one of the things I think that we're seeing is we're moving into a world where the economic impacts are decoupling from the health impacts. We're seeing larger and larger economic losses for more and more modest biological events. And it's a new world that we need to kind of get into, and the chief modulator there is going to be the behavioral response part. These economic impacts now are clearly outlasting the epidemiological events, and I think that trend is set to continue because for as much as we do around the human biological security elements of this, until we've got a better way of handling and mitigating these longer-term economic costs, they'll just continue to diffuse through our economics and social systems. And there are huge equity implications that I haven't been able to go into here, but poorer communities do much worse over the long term. I should, having complained that we don't do much post hoc analysis, take my hat off to the World Bank, who have been actually phenomenally good following up on the regional impacts of Zika and Ebola. Some really good household-level survey microeconomic assessments. And it's more of this that we need to be seeing, because this is the thing that will help us calibrate and refine our predictive models better. And my last point, which I'll finish on, is this. Look, the Snowglobe world is helpful, it's useful. General equilibrium models are good, but we kind of need to check that they calibrate to the real world. And to do that, we need to get better at collecting this data. And that's my time up, so I'll finish there.